Okay, well, thank you for joining us on this panel about federalism. The title, of course, is We're the Feds and We're Here to Help, and I think the important thing to put things into perspective is that increasingly state budgets see their total state budget becoming more and more dependent on federal funds. As recently as just a few years ago, you'd see the average state budget was no more than maybe 15% federal. And now we're approaching the point where we're getting close to 40% or more, depending on the state, of its total funds that it spends are coming from the federal government. And of course, that's not without strings. Increasingly, federal policymakers are hijacking state governments to enact policies of their own at the state level, policies that frankly they don't have to take responsibility for because they're passing them at the federal level. And expecting then the states to execute them. For today's panel, I think we have some people who are on the front lines of seeing exactly what happens when the federal government begins to hijack the machinery of state government to its own ends. We have Commissioner Pauken, who will talk about some missed opportunities to protect state sovereignty from federal intrusion. Now, anyone who knows anything about Commissioner Pauken would know that he played an instrumental role in the early years of the first Reagan administration. And for someone like me who was a college Republican when he was in the Reagan administration, he was actually one of my heroes back when I was 19 and 20 years old in the early 80s. We all knew about him because he was one of the true revolutionaries for the Reagan era. Next we have Director Garameni, who will talk about exactly what ends up happening when federal conditions are put on federal funds to the states, because she's at the front line of course, this large and rapidly growing part of state expenditures dealing with health care. And obviously with Obamacare, that area is very much within interest right now as that expands. And then lastly, we have the Foundation's own Mario Loyola, who is the director of our Center for 10th Amendment Studies. And he's going to talk about it from the standpoint of someone who is a constitutional scholar about the general problem of mixing state and federal functions. And so if we can, I'd like to start then with Commissioner Pauken. And let's, you can, all right, very good.
Thank you, Chuck, and it's good to be with you today. The topic, of course, is the Trojan horse of federal assistance, and we're in a kind of situation that reminds me of the words of my old boss, Ronald Reagan, status quo is Latin for the mess we're in. And or to borrow a phrase from Will Rogers, if stupidity got us into this mess, why can't it get us out? The question becomes, how do we reverse the tide that's been running against us so long in terms of the centralization of governmental power in the hands of the Washington bureaucracy? Not only is the Obama administration clearly the most liberal regime in American history, but it has also been the most aggressive in using laws and regulatory authority to advance its political agenda. It's leading us to what Hilaire Belloc warned about in The Servile State when he said, to control the production of wealth is to control human life itself. In his great work, Democracy in America, Alexis de Tocqueville was prophetic on the dangers of centralization of power and the direction of America today. Quote, the supreme power then extends its arm over the whole community. It covers the surface of society with a network of complicated rules through which the most original minds and the most energetic characters cannot penetrate. It does not tyrannize, but it compresses, innervates, extinguishes, and stupefies a people till each nation is reduced to nothing better than a flock of timid and industrial animals of which government is the shepherd. We're experiencing today a steady encroachment by the national government of the constitutional principle of federalism, a principle that calls for the general diffusion and separation of powers so that wherever possible, governmental power should reside in the states, communities, or in the people themselves. In the words directly of the 10th Amendment to the U.S. Constitution, the power is not delegated to the United States by the Constitution, nor prohibited by it to the states, or reserved to the states respectively or to the people. I want to discuss today the specifics of one example that directly impacted our agency in the state of Texas during my tenure as chairman of the Texas Workforce Commission. That is a state agency that's effectively the Texas equivalent of the U.S. Department of Labor. Legislation was passed in 2009 by the democratically controlled Congress and signed by President Obama relating to unemployment insurance, which is what we oversee in the state of Texas, which was a clear violation, in my view, of the 10th Amendment to the U.S. Constitution. Sadly, Texas not only lost tax dollars we were entitled to receive, but we also missed a great opportunity to challenge a federal law on 10th Amendment grounds. Here are the facts. In 2009, Congressman Jim McDermott, a liberal Democrat from the state of Washington, who long has favored the nationalization of state unemployment laws, introduced a bill which subsequently passed to further that objective. Texas has a state unemployment system which is much more employer-friendly than comparable laws in states like New York and Illinois. Representative McDermott's legislation was entitled, quote, the Unemployment Insurance Modernization Act. Now, one should be particularly nervous when a congressman introduces a bill that uses the term Modernization Act because inevitably, as in this case, it means the expansion of federal power. The legislation in question provided for a $7 billion distribution from the federal unemployment account to the states. Pursuant to that legislation, Texas was supposed to receive $555 million to go into our unemployment insurance trust fund. It really was just getting back into Texas our proportionate share of total FUTA taxes paid to the federal government by Texas employers. In the past, when individual state unemployment trust funds had experienced financial stress in times of high unemployment, the federal government had simply returned to the states the money without strings attached. But McDermott's legislation changed all of that. To receive the $555 million that was rightfully ours, Texas had to change its laws in order to cover people who formerly had not been able to receive benefits under Texas law. In fact, the feds were trying to dictate Texas law. So what should we have done in response to this example of federal overreach? The first question I ask as chairman of the Texas Workforce Commission, is there an opportunity to get the money we were entitled to without the strings attached? Secondly, is the federal legislation in question even constitutional? I ask our legal staff at the Texas Workforce Commission to look at both questions and see what our options were. It soon became clear that on the first issue, there were two ways to get the funding without any financial loss to the state or long-lasting damage to our state unemployment system. One option was to draft legislation which would allow for the required legislative changes to be made in order, quote, to conform, unquote, with the federal law and receive the $555 million, but include a provision in that law which would sunset the legislation once the federal funding went away. Texas law then would revert back to the previous state law regarding unemployment compensation. Second option would have been to pass the required legislation, get the $555 million, and then repeal the legislation in a special session or in the next legislative session. In both cases, we would have come out financially pretty well in either case. As for the constitutionality of the federal legislation itself, constitutional scholars who had reviewed it pointed out serious flaws in the legislation itself. Writing in the Chicago Tribune, Chapman University Law School professor Ronald Rotunda had this to say about Congressman McDermott's legislation. Because some governors might not accept money, Congress added a unique position in subsection 1607B. If funds provided to any state in any division of this act are not accepted for use by the governor, then acceptance by the state legislature by means of the adoption of a concurrent resolution shall be sufficient to provide funding to such state. If state law does not give the state legislature the right to bypass the governor, how can Congress just change the law? Where does Congress get the power to change a state constitution? It might appear quaint to note that the U.S. Constitution does not create a central government of unlimited powers, and as the law professor pointed out, Congress only has those powers that the Constitution gave it expressly or by implication. That's a lot of power to be sure, but it's not unlimited. It's unlikely that subsection B will survive constitutional challenge. This appeared to be a classic violation of the 10th Amendment clause to the U.S. Constitution. We consulted with Greg Coleman, a former Texas Solicitor General who had clerked for Justice Clarence Thomas and had won 2 cases before the U.S. Supreme Court. Greg, who unfortunately later lost his life in a tragic private airplane crash in Florida, not only had won 2 cases before the court, but he believed we had an excellent prospect of getting the legislation declared unconstitutional on 10th Amendment grounds. And he was willing to represent the Texas Workforce Commission and the state of Texas in our constitutional challenge. But to even have standing in order to challenge the constitutionality of the law, we would have to pass a state law along the lines I was proposing. By then, we were confident that legislation could be passed with bipartisan support in the Texas legislature that would secure the federal funding without having a negative financial impact on our Texas Unemployment Insurance Trust Fund, and also at the same time without strings attached. If the Obama administration refused to provide the appropriated funds to Texas, then we had standing to sue in the U.S. District Court in Texas on 10th Amendment grounds. In briefings with business officials at NFIB, legislative leaders, and officials in the governor's office, I was pleased to get a positive reaction to this proposed strategy. State Representative Tan Parker of Denton and Senator Kevin Eltife from East Texas were lined up to introduce the proposed legislation. Then all of a sudden, a member of the governor's staff, who had, I am sure, the best of intentions, encouraged the governor to turn down the $555 million in UI funds, as Governor Sanford of South Carolina had done recently. An Austin representative of a business organization suddenly became very vocal on the subject as well. And yet, without any serious discussion with myself or others on the proposed alternatives, the governor decided to simply turn the money down. As a result, no legislation got passed. The funds that rightfully belonged to Texas went elsewhere. Taxes on Texas employers to keep the unemployment insurance trust fund solvent had to go up. And most importantly, in my mind, a terrific opportunity to challenge a clearly unconstitutional law on 10th Amendment grounds was lost. This is just one example of many where even our own Republican leaders have failed to challenge effectively the federal encroachment of state prerogatives. Take the case of Section 5 of the Voting Rights Act, which punishes a handful of states and jurisdictions, including Texas, for something that happened more than 30 years ago. Texas is required to get permission from the U.S. Department of Justice to change any election law or polling location. Can anyone say with a straight face that elections in Chicago or Philadelphia are cleaner than Texas elections? Our state currently is involved in a legal dispute with the federal government on a voting rights dispute that has cost us millions of dollars already in legal fees. And yet, where were our state leaders in 2006 when Congress, with both houses of Congress controlled by the Republicans and a Republican in the White House, passed an extension of Section 5 of the Voting Rights Act for another 25 years, which put Texas's electoral process under the continued scrutiny and control of the U.S. Department of Justice. The leftist side is determined to erode our constitutional form of government. If we as conservatives are serious about challenging them effectively, then we've got to outsmart them and outwork them. Rather than settle for 30-second sound bites and public relations gimmicks that may play well politically, but do nothing to advance Texas's interest against an overreaching federal government. Rather than always being on the defensive and reactive as the left advances its political agenda to centralize power in Washington, D.C., we need to be proactive in developing common sense strategies that force the left on the defensive. That's the kind of conservative leadership we had during the Reagan era, which took the fight to the left. We need a new team of serious-minded and authentic conservatives to do something similar today when the stakes are so much higher. Talk is cheap, political posturing is easy. Doing the hard work necessary to return power to the states, communities, and people themselves, as the founders intended, is what is called for if we're serious about getting America back on the right track. Thank you.
All right, next up then is Director Garamani. Thank you.
Good afternoon. I'm Kay Garamani. I was recently named the Medicaid Director in Texas. Prior to that, though, I was the Policy Director, and I've worked with Medicaid for a long time. As I was thinking about my comments for this afternoon, I could not come up with one example of where the federal government has made it better or easier or cheaper for Texas to administer the Medicaid program. And as I said, I've worked with the Medicaid program for a long time. The federal government oversees every aspect of our program, although we pay for over 40% of the cost of the program. The CMS, which is the agency that oversees the Medicaid program at the federal level, it's an agency within the Department of Health and Human Services, is really like an overbearing, dysfunctional parent. And I say that because they control. We cannot make a change in who we serve, services that we provide, the way we provide our services, the way we pay our providers. Everything has to be run through CMS. If we open up a change to CMS, then they will go through a lengthy approval process and then often will add more requirements on us. So it's always a risk for us to even ask for a change because of that. And then there's a lack of consistency once we do get approval on something. So state plan amendments and waivers are really our way of having a contract formal agreement with the federal government. And we'll get approval on something, and then after we've implemented it, they will make us undo it. So it's a lot of frustrating interactions that we have very, very regularly. I have a lot of staff that all they do is try to work through these issues with CMS. The Medicaid program is an important program. We do serve the sickest people in this state, people who have really significant disabilities, and people who are very poor. The program has grown over time because of federal requirements that have required us to add new populations to the program, and we now serve between Medicaid and the Children's Health Insurance Program, which is another federal state program. We serve over 4 million people monthly in Texas. The program, both in size and budget, has more than doubled in the last 10 years, and we're now 26% of the state budget. Our legislative appropriations request for this upcoming biennium is over $61 billion, all funds. So it's federal and state. But it's a very, very large program. States across the country are very concerned about the increase and the significant increases that happen without the ability to make some changes that would allow us to make the program more efficient. The problem, it really starts with the statute, the Medicaid statute that's part of the Social Security Act, Title 19. It was originally enacted during the LBJ administration, and it has been amended many, many times over the years. The problem is then compounded by CMS when they get their hands on it. The regulations that CMS promulgates always have more requirements in them than what Congress intended. And so you sometimes start with bad legislation, and then it just is made worse when you have to implement some of the things that are required. I was going to give you just a few examples to give you some context for what I'm talking about. There was an example that I just recently shared with Dr. Janik, who some of you might have heard this morning. He's our new Health and Human Services Commissioner, and he's my boss. There is, many states have implemented copays, and copays are, when you go to the doctor and you are charged, for us, we're charged $25 copay if we go to our primary care doctor. They're a way to have the person who is getting the service participate in the cost of that service. And it's also a way to help control utilization, because I'm going to think, if I feel a little sick, well, maybe I don't need to go to the doctor. And that $25 copay it can help people make a good decision about whether they need to seek medical care or not. The requirements in Title 19 are very, very restrictive for states. And we do in Texas serve very poor people. Most of the people that we serve are below 100% of poverty. So we're talking about very, very low income families. It's about $22,000 for a family of 4. Yet everybody across the board, from very liberal groups to very conservative groups, believe that copays are a good thing. They help make people more responsible for their health care, and our clients would like to pay copays. But regardless of that, the Title 19 requirements and restrictions make them difficult to implement. Then on top of that, CMS has added some requirements on states, and recently for the state of Arizona, there's a big problem with our clients missing their appointments. It happens a lot more regularly than it does for, say, families, even in the CHIP program, where the provider can charge a copay or can charge a missed fee if the person misses their appointment and doesn't call, and more than people who get commercial insurance. In any event, providers don't want to take our clients because of the missed appointment issue, because we already don't pay them very much, and then if somebody doesn't show up, they're losing money when they could have had somebody else in that slot. And so what Arizona requested is if they could charge a missed appointment fee of $25. After a lot of negotiations, here is what CMS decided. And again, the copays or the missed appointment copay can help us get more providers in our program because it will help reduce missed appointments, and then providers will be more likely to sign up for our program. They had proposed a $25 fee. CMS eventually approved a $3 fee, and they put these following restrictions on it. One, they only approved it for a year, and then they were going to evaluate it, and CMS said they might approve it for one more year after that. It was only for a very restrictive group of adults, only for people who didn't live in Phoenix or Tucson, which is where all your people live in Arizona. So only in the more rural areas where transportation is a problem, and so that didn't make sense. And then providers are required to submit a plan. If they want to charge a missed appointment copay, they're required to submit a plan to the state of Arizona to get approved, and it must include, these are just some of the requirements that have to be in that plan. They have to provide written notification to their members or their clients who've missed what the appointment policy is. They have to get them to sign it, and they have to get them to re-sign it annually. They have to provide written confirmation of the appointment. They have to provide 48-hour notice of the appointment and maintain records of the notification they provided. And they must provide notification through at least 2 mechanisms, so like text, phone, email. Then the providers have to agree to track and submit quarterly reports to the state that include the reasons that the members missed their appointments, which how is a provider going to know that if they didn't show up for their appointment, the number of copays that they have assessed, the number of clients that were assessed the fee more than once, and the average number of times that they assessed this population. So it was just ridiculous paperwork that these providers were going to have to submit just to be able to charge this $3 missed appointment copay. So there's numerous examples like that. That's the reason why Texas has hesitated to implement copays, simply because you end up with a lot of administrative burden on the part of the providers and on the part of the state. And there's many, many examples, but I'll go ahead and skip to the Affordable Care Act, which made a lot of things more difficult. One of them is there was a requirement that no state could change their eligibility in any way for their program. In Texas, we serve, I said 3.7 million people. We do not serve a lot of what are called optional populations, but we do have some. But regardless, CMS said you cannot reduce your eligibility in any way. You can't even change your procedures on how you do eligibility. You can't change your standards. And in Texas, we had realized that we had a problem because we were not asking for women to get a doctor's note to verify that they actually were pregnant. So a woman would come in and she could say she was pregnant and she was going to get coverage for the duration of what she said was her pregnancy, and then 2 months after that. And so if a person wasn't pregnant, woman wasn't pregnant, you're giving them, a year or more of coverage, up to a year more coverage. And when we tried to implement the requirement that they have to submit a doctor's note, that CMS said, no, you can't. That's a violation of ACA. So even though we were trying to implement something that would prevent fraud, we weren't able to do that. There are numerous examples in ACA. There's a primary care provider rate increase. So what Congress did is they put a 2-year rate increase for primary care providers, which already is a problem because Medicaid is, we pay about 75% of what Medicare pays. CMS said, you've got to raise your rates, and we'll give you 100% of that difference to raise the rate up to the Medicare rate. Then when the regulations came out, it's like, oh no, if you've had any provider rate cuts recently, you're going to have to make those up. And then they extended the rate increase to most subspecialties. So the rate increase was supposed to be targeted at getting more primary care providers in the networks, and instead it covers most subspecialties. So we'll be in a position now in 2 years after the rate increase of having to give a large pay cut to these providers, and that is a coercive kind of gesture on the part of the feds, because it's very difficult to give providers a cut after you've already given them an increase. So a number of other things that have made it difficult to administer the things, even some of the optional things that are in ACA for states to do, such as creating health homes, which is really a way to provide better continuity of care for clients. They've made the restrictions so difficult, and we have mainly a managed care program, can't implement that. Numerous things. We have about a 9% annual growth rate in Texas in our Medicaid program, but that's really because of our caseload growth. We have pretty much a flat growth in our medical costs because we really do manage our program very efficiently. I mean, states have really figured out how to, even within the constraints of what the feds require, manage their programs well, and I think we actually have a lot to share with the Medicare program. I think we can help the feds better manage their program. It would really require scrapping Title 19. If we really wanted to make some big significant changes to the program, I think you'd have to start over. I mean, you could have a piece of legislation that was a page long, and instead, and the regulations could be about a page long, but we're a long ways off from that. I'm out of time. I was going to read 3 principles from a document that my former boss had actually started with a couple of other Medicaid directors that then became a principle and policy document that the Republican Governors Association adopted this summer. In any event, I'm glad to share this with folks afterwards, and it does talk about really the way that the Fed should be allowing us to manage our program, which is, that we know what's best for people in our state. We are going to be good stewards of our Texas taxpayer money, and we will do what is, we know what populations we serve, very diverse populations in Texas compared to Rhode Island that has the same kind of requirements imposed on their program. And that we really need to be able to, they need to, focus on, if we are held to the standards of quality and promoting healthcare outcomes, that should be about the extent of regulation that would be required. So, thank you.
So I'll have just 10 minutes at most of comments. You guys can start throwing stuff at me if I exceed that, because we lost 20 minutes at the top of the program, and I really do want to get to your questions as soon as possible. I thought for a second there that you were going to say that Title 19 should be nuked from orbit. You sort of almost, I was like, is she going to say it?
Was I too gentle in the way I phrased that?
But I mean, the problem is, and Title 19, of course, is of the Social Security Act of 1965, which is what created the Medicaid program to begin with. And at first the federal government says, well, let's guarantee a certain baseline for everybody, and we'll give money to the states to administer it. And it all sounded very nice, and then of course we want to put certain conditions so that the states don't, run away with the money and spend it on a theme park or something. and that's all sounded very reasonable. But of course, what the federal government quickly discovered after that is that once all the states had accepted it and all the states were dependent on this money, they could start imposing more and more conditions. And I tried to figure out, what the conditions were once the Obamacare ruling came down. I went into the bowels of the federal register, the Code of Federal Regulations, and the United States Code, and tried to figure out exactly when these different amendments had been imposed and whether existing Medicaid matching funds had been conditioned on new program expansions, whether anything else could fall under the arrangement that was struck down by the Supreme Court in Obamacare. And I couldn't believe, I wanted to hire a team of lawyers to help me figure this out. I mean, it was just hundreds and 150 different conditions, and so minute, on things so minute that you can't believe that the federal government would care at all. But of course, the reason the federal government cares is that this is one of the main ways in which it's taking over the state governments. And so through the banner of this federal assistance, which, by the way, is totally unnecessary, and I'll get to that in a second. Through the banner of this federal assistance, what the federal government has been doing for really since the 1960s in earnest is just taking over the state governments. And we just inaugurated the legislature this week in Texas. The big obstacle in transportation, education, and health and human services, legislators are going to be dealing with the fact that they're operating within a straitjacket of federal conditions on not just on the money that they get from the federal government, but on every aspect of their program, on how they spend their own money, on basic issues of policy that have nothing to do with how the money is to be spent, right? And so, and so I think the conclusion that I've come to, and if you're into splendid literature, there's this article that we've published in the American Interest magazine. You all should have a copy of. Called the Federal State Crack-Up. And what I've tried to argue in this article is, what I've concluded after several years of looking at this, is that you really have to separate the functions of federal and state government, because we're going to open up a legislature in which state legislators are going to be very limited in their ability to respond and reflect their constituents' preferences, because their policies are being imposed on them from Washington on matters of purely state prerogative. And if you want to, I worked in the Senate, I've worked for the federal government, I have a lot of admiration for the federal government when it sticks to the things that it's supposed to be doing and the things that it does well, right? And so when you have a fire in Bastrop, I was in Bastrop a couple of days after the fire. Senator Hutchison arrived on a surprise visit, and there were FEMA responders there, and then the big wildfire. Most of the big wildfires in the United States occur on federal land because the federal government owns the entire West, right? And then the entire West blows up every once in a while, and they have to put out the fires. So the federal government, the state of Texas doesn't have 15,000 firefighters, large-scale fire, open-range firefighters, sitting around for the major wildfire that's going to appear once every 20 years. And so that's an example of necessary federal assistance. All of a sudden there's a major wildfire, there's huge resources sitting out in Wyoming and Arizona and Colorado, and all of a sudden they arrive on the scene and everyone's very grateful. Now just imagine if they arrived on the scene and said, okay, so now you guys are look like you're in a fair bit of trouble. We're here to help, but however, we would like you to become a union state. So we're going to wait until you pass union laws to become a union state, and then we'll give you all of this money. That would be preposterous, right? Well, there's 600 federal programs that are just like that. Okay, and the conditions go well beyond how the federal money is to be spent, or even the federal interest in the program. It's a very insidious way for uncompetitive states, such as California. I'm not
I'm here.
causing any offense, right? such as California and New York and Illinois, who suffer losses from the advantages of competitive states. There's one way that they can eliminate the competitive advantages of the competitive states, and it's through the federal machinery. It's through the machinery of federal funds for the states and through the machinery, by the way, a topic that I get to in my article, but which we can't discuss today, of regulatory cooperation, which is when the federal government, that's also in the Obamacare law, right, set up a state exchange, and we give you permission to set up your own exchange. The option is that we'll come in and set one up for you, and we bet you're really not going to like that. But we'll let you set up your own one as long as you do it exactly the way that and then they sell it to you as you've got all this flexibility, but of course there's no flexibility, right? And so in either case, the states are just letting themselves be deputized into the service of the federal government, not just of the federal government as like some entity with its own, like an alien that needs to be nuked from orbit. It's the coalition of uncompetitive states that controls the federal government that passed all of these laws and policies and appropriates all these funds to begin with, right? And notice, it's too bad, it's a missed opportunity that this hasn't come up in the debt ceiling talks and in the fiscal cliff talks, because it so happens that this year the federal government is going to be transferring about 5% of the nation's GDP to the states in the form of federal assistance. And the deficit is about 7% of GDP. So basically, because all the states, it's a very good thing, right? I think you'd both agree, that the states can't run huge deficits. So they have to have budget discipline. Well, that's not true, because what's happening is that the federal government is running the deficits for them. And the price of the federal government running deficits for them and ballooning all of the state programs to unmanageable and unsustainable a scope is that the states have to give up their ability to respond to their constituents' preferences. So this is, you said a magic word at the end of your presentation, Director Garamani, the word coercion. All of these programs are intrinsically coercive. I mean, they're not coercive in the sense of, there's no coercion when the federal government shows up and says, okay, we've got 11,000 firefighters, but we've got a whole plan that whereby we like plug in your state and local firefighters into our command scheme, and we've got a what do they call it, a unified response commander at the top. And, that makes sense. I mean, it's not like they're taking over the state governments when they do that. They're going to come in, they're going to do an operation, they've got it organized, they know what they're doing, and then they're going to leave. And that's what they're there for, and that works great, right? And I think everyone can agree that that's not coercive. But what is coercive, what is very deeply coercive, is when the federal government comes in and says, we're going to give you all of this money, and you have to not only spend it the way that we tell you to, but you have to adopt a whole bunch of policies on issues that the Constitution, that even liberal scholars, even liberal law professors agree, the Constitution, the federal government cannot impose upon the states directly, right? Because the federal government cannot commandeer the states. It cannot pass a law that says, State Control Act of 2013, the states shall adopt the following laws. It cannot do that. But as long as it can tax money away from the states and send it back to them on condition that they comply with what they would like to be in such a law, it's the same thing. Because the states they lose too much money. And that's the most important thing to remember, is that all this money that the federal government is spending is coming from the states to begin with. They're taxing it away from the states' residents, they're sucking it out of the capital markets, and driving up and leaving capital unavailable for the economy. And then they send it back to the states on condition that they be allowed to take over the state governments. That practice, I think, the good news in the Obamacare ruling earlier last summer by the Supreme Court was that they said you, the federal government, cannot condition existing Medicaid funds on the adoption of an entirely new program. But unfortunately, it sustained the underlying case, South Dakota versus Dole, the 1987 case, that said that the Department of Transportation could take away 5% of federal highway funds in states that didn't raise their drinking age to 21. Until the Supreme Court realizes that that case was wrongly decided and needs to be reversed, that all such conditions, no matter what form they are, amount to coercion, amount to a coercive violation of the 10th Amendment and of the structure of dual sovereignty in the Constitution, we're going to continue to have this problem. And state legislators need to know, every time the feds say, we're here to help, don't believe it. Thank you very much.
Right, you've now heard from two individuals that are actually implementing policy with very specific case studies here in Texas. And then you've heard from a constitutional scholar that has kind of laid out the case for why the federal government's current policies amount to an insufferable encroachment on state sovereignty. So if you have a question, what I'd appreciate is if you could briefly let us know who you are and to whom the question is addressed, whether it's addressed to one specific panelist or whether you'd like all three to answer the question. And please make your question as succinct as possible. To the former state senator from the great state of Illinois.
The great bankrupt state of Illinois. I want to tell a story a second, which will be your question. We had a few years ago, back when I was a senator, the federal government said they didn't like the way we were running our Department of Corrections and told us to change it. We said, up yours. We're not going to do it. They went to a federal judge. Federal judge says, you've got to do this. We said, up yours. We're not going to do it. Our governor, being the pillar of strength that he was, peed in his pants about 4 times, and he came and met with the Senate. So we got to do this. And we said, up yours. We're not going to do it. It's a fortune. You go back and you tell them we're not going to do it. Guess what happened? They backed down. The advantage you have, forget that we have a large congressional delegation, forget that we have senators who can filibuster. We now have Republicans in Washington who are, frankly, looking for a fight, and the 10th Amendment's a fight they'd like to have. So I throw this out to the three of you. We won when we did. It had to do with corrections. I won't waste your time with the full story, but federal government backed down and a federal judge backed down. You can do it. You just have to decide it's going to be real unpleasant for a couple months.
Well, that kind of goes to what Commissioner Pocken was talking about to begin with, where you were actually, I think, looking for an opportunity with the unemployment insurance compensation that unfortunately didn't come.
This was probably as good a 10th Amendment case as you could possibly ask for. I mean, it was clearly unconstitutional. And the irony is we would have been able to pass bipartisan legislation, go to Hilda Solis and give it to her and have her essentially reject it, and then we're right in U.S. District Court. And I think they would have been in a very difficult position and would have backed down, precisely what you're saying. But you've just got to, outsmart them, and you've got to, you know, it's easy to say something when you're not going all the way through or willing to take the fight to the left. And that's what we did in the Reagan administration, time and time again, and it worked, particularly in the first term.
But Vincent, you got to pick the case, and
You got to pick it right.
Commissioner here, tell them we're about to drop 1 million people off public aid because you're making it impossible. Okay, let them fight about it. I mean, pick something to fight about and fight. Our problem, and I say this affectionately, the states have tended to be spineless as the government's gotten more powerful. Stand up to them.
Amen.
And we did. We won. And Illinois is as wimp as they get. And Illinois can stand up to them. Look what Texas could do.
Absolutely. You're absolutely right.
Yeah, we do. I mean, we are in we're in constant, you know, kind of tension with them. It's over littler things, so we don't have an effort underway to take on something big. I mean, you know, CMS, what they do is they withhold our money, but
Let me give, I mean,
Hold it for long.
but there's, you know, and Mario, you allude to it in your article, the language of Justice Roberts, that in effect the feds cannot dictate with regard to Medicaid, may have an opportunity to open the door and find some way to do with it. But we're not doing this kind of proactive, you know, thinking and reacting. I mean, we're just sort of bashing Obama, and that's great. Makes us feel good, but what are we accomplishing?
Well, that's something that I was just going to say that you know, one thing we can all agree on I think is that the Obamacare decision in the Supreme Court was a lemon. But the good thing about this lemon is that it's the Democrats' lemon. They own it, they celebrated it. And when they discover in 10 years, oh wait, what did Roberts say exactly? You know, little known phrases now that he slipped under the radar. And I think that that's where we have the basis. Now, of course, if Director Garamani's program fails to comply, if they say, you know what, screw you, we're going to do things our way, and you lose, what would you lose, 15 million? I mean, they could lose more money than is in the entire rainy day fund.
we did actually push on. We have a program called the Women's Health Program that provides family planning benefits to women who don't qualify for any other kinds of services. And we have run that program through a waiver, what's called a waiver, which allows you to do things in a different way, including allows you to restrict your provider base. There was a law passed last session that said that abortion providers and affiliates of abortion providers are not allowed in the women's health program. And so we changed our waiver to say that we have this restriction. And the Fed said, no, we're not going to, they've dropped the program. So they've dropped their funding for the program.
I apologize, Chuck, for the way you do it. You bring in your congressional delegation. The governor explains to them what we're about to do. And then, remember, they're not going to pass a budget. The Democrats can't pass a budget. It's got to be a continuing resolution, okay? In other words, basically last year's budget. The Democrats trying to take your program out. You think the Republicans are going to sit there and pass a continuing resolution, watching Texas get screwed, the biggest Republican state in the country?
But the administration of the program has already been delegated to HHS, so Congress can't even affect it now.
So you take out the money. I mean, I'm saying, you can screw with them. We just have to aggressively screw with them.
Well, for that. Yep.
We have another question over here, and then we'll get over to the back row next.
I don't need to stand up. I just want to make a comment. Our government over the last 25 or 30 years has made the decision that we, the people, don't have enough gonads, like the senator is saying here, to tell them what we want. And I think it's incumbent upon us, like Commissioner Palkin was saying, that we have to tell them they work for us. You know, the more progressive, if they want to call themselves that, the more socialistic they become. We become subjects and not citizens. And I'm on the move to change it. Thank you, that's all.
Thank you.
In the back row, please.
Hi, my name is Elena Schneider. I'm a reporter with the Texas Tribune. And my question's for Commissioner Palkin.
Sure.
Palkin, excuse me. So you alluded to Governor Perry and about his decision to not go with the money. So could you explain a little bit more as to what that decision process was and whether or not it was related to his sort of speculation in looking into a presidential run?
I don't know. I can't speculate on the motivation, but clearly we put together, I think, a very effective strategy to, A, get the money without the strings attached. If they refuse to do it, then challenge the law, which, and Greg Coleman, again, some of you in this room may know him. I mean, he had won 2 cases in the U.S. Supreme Court, an absolutely brilliant constitutional lawyer, and he felt very good about the case. But to get there, you had to have standing. And for whatever reason, you know, I don't know that Governor Sanford and the people in South Carolina had thought this thing through like a bunch of us had thought this through. And so Sanford issued a statement, we're just not going to take the money. And then a staffer on the governor's staff pushed for that. And all of a sudden, the governor said, you know, that sounds good. Well, you know, the problem is the $555 million goes elsewhere. We got to, the employers fund the insurance trust fund. We didn't get the money. We had to raise employer taxes on Texas employers. This had never been done before. And I know what McDermott was up to, but we had a way to effectively outsmart him, and that legislation was god-awful, and it was so blatant that I think this would have been a case that may have had long-standing implications, and it's just, I think, a lack of thinking through how to influence policy in a serious way and how to beat the bad guys who are trying to centralize power. And I just, we didn't do that during the Reagan years. I mean, Reagan was, we were serious about coming up with common sense solutions or picking the right kind of challenge. It wasn't perfect, but taking them on. I mean, and doing it the right way that made sense. And I just hate to see we could have gotten the money and at the same time had a marvelous 10th Amendment case. So why this was done, I just don't think there was careful thought and consideration. And as the senator alluded to, these are tough issues, but it's nice to say we don't like what they're doing, but trying to figure out a strategy to prevent them from doing is the key. And I think we're missing on that on many fronts. And again, you got to be very prudential in how you pick your fights, but this would have been a great fight to pick, quite frankly.
Right there in the aisle. This will be our last question of this panel. Thank you.
My question is for Ms. Garamani, and my name's Elaine Hayes. I'm a financial planner from Amarillo, Texas. And in working with the CMS, I'm curious as if you notice a difference between difficulties, whether there is a Republican or Democrat Congress. My understanding is that they're receiving funding, but Congress isn't doing all the details. Like you say, they start with the bill, then it just gets details within the agencies, and how that power can be taken back, and just the differences you see working with the different.
There are no differences. I mean, there's no difference. When under the Bush administration, CMS got the bright idea that any rates that we had that were bundled rates, meaning we would only pay one fee for, a set of services, they made us unbundle all those rates. And we told them it's going to be more expensive, and they didn't care. We had to unbundle all these rates, and it cost us more money, it cost the feds more money. There's not much different. The processes aren't different. The approvals, the scrutiny, it's the same.
Did you ever see I think it's a 1964 movie, The Blob? Do you remember that?
I think they did a remake of it
It's
as well.
It's just a federal bureaucracy through. That's actually, there's a reason, and I fought there was an argument early on when I was discussing this article with the editors at the American Interest. They were saying, well, delegations of rulemaking authority from Congress to the executive branch are not really a federalism issue. But here's an example where it is a federalism issue, right? Because we can win an election at the federal level, and it doesn't matter, because even if you have a pro-federalist administration, so much power has already been delegated to this nameless, faceless blob of civil service in the executive branch, who are really the ones who control the government in situations like this. And so I think that it's separation of powers, not only between the federal and state governments, but also within the federal government.
And one additional comment, Senator Bob Deuel tried to get a waiver, Medicaid waiver, when the Republicans controlled. Bush was president, and who was head of HHS at the time from Utah? Governor Romney's Levitt was HHS advisor. Rhode Island got one, Texas didn't.
Well, thank you very much, ladies and gentlemen, for attending this panel.
Thank you so much.